Bismillahirrahmanirrahim. Hi guys, Assalamu alaikum. My name is Dr. Sufi Hasibul Hassan, and please let me ask you a question. Why are we so obsessed that every cure of anything, including COVID-19, can and will only come from high tech labs? Why don't we understand the philosophy of medicine? Any epidemic can only be truly defeated if we can find the cure. Time is precious and I have my own limitations. Previously, I had launched my first video on 17th April 2020 revealing a possibility of getting to a treatment of coronavirus COVID-19 by making antibodies in horses and using this horse anti-serum antibodies as a possible treatment for COVID-19. In that first video, I had said that I have a few more ideas if somebody is interested. Also, the lockdown have practically ended here in Pakistan and it is being feared by many doctors etc. that the number of corona COVID-19 patients might rise to overwhelming numbers. So today I am launching yet another video which will not tell you about plasma transfusion from recovered coronavirus patients to new coronavirus patients as told to us by the Chinese and others. This time the clinician will not just sit and wait because nobody is giving him the horse anti-serum antibodies to treat the COVID-19 patient. Although there is news that Turkey will begin animal testing in horses, etc., next week in its effort to develop an anti-serum to tackle the novel coronavirus epidemic. I will post the link to this news regarding efforts of Turkey in the description below. However, now returning to this second new idea, which is the subject of this video, I was saying that it will be more close to the reach of the clinician and the private lab. So today I will be unfolding yet another new possibility and approach of treating coronavirus COVID-19 patients. Again, as previously, I am trying to present this video in a common man, easy to understand language as much as possible. Although, also note that I am presenting this video as just one possibility of treatment of coronavirus COVID-19. This is not being presented as a final treatment, but is being tabled as a possible treatment for consideration and discussion to the collective wisdom of other doctors and resourceful institutions, research medical universities, print and electronic media, etc., all to collaborate to think upon this and apply their minds to as a possible treatment for COVID-19 patients. Nearly every virus has a target organ. The hepatitis virus has the liver as a target organ. Similarly, according to the information available up till now, the coronavirus causing COVID-19 has the respiratory tract as its main target organ. But its reach can extend to many organs, including the heart and blood vessels, kidneys, gut, and the brain. What makes the virus to be targeted to a specific organ? Well, it's the protruding spikes of the coronavirus which have specific binding S proteins which bind to the ACE2 or ACE2 receptors on the cells of the target organs. The makeup and machinery of this predominant respiratory system targeting virus is such that not only it can attach or anchor to epithelial cells of the respiratory system, but once in the respiratory system, it can reproduce in the epithelial cells and can outwit the host body defense system cells. In literary terms, this virus is very annoying and frustrates the host defenses so much that in some people, a healthy immune system reacts with a high handed response and launches a cytokine storm. This over responding starts to damage not only the infected epithelial cells but also the bystanders, that is, the lung parenchymal cells. The situation therefore becomes serious with the COVID 19 virus replicating and destroying the epithelial cells, and the defense response not only trying to kill and neutralize the virus but in the battle also injuring the bystanders, that is, the lung parenchymal cells, and causing undue inflammation and collateral damage. So, the invasion of the virus on the lung epithelial cells and the body defense immune system cells trying to launch a defense response are both leading to swelling and damage to the lungs, and the patient is getting increased breathing difficulty, and the patient condition is getting serious. This is all happening because the main battlefield is in the lungs. And as an analogy, supposing if a special tropical rainforest fighting division of an army invades a strategic target in a tropical jungle, the defense forces there might not be able to stop the attacking tropical rain jungle division, for it is specialized and equipped and camouflaged and trained to attack and capture and fight under the tropical rainforest conditions. But what if somehow the battlefield is changed? The conditions are suddenly changed, and the same tropical rainforest attack division now suddenly finds itself in a desert with no ammunition and with desert trained defense forces now fighting this tropical rainforest division. Then the chances are that these defense forces will now wipe out the whole tropical rainforest division in this desert, and also there will be no collateral damage because now the battlefield is the desert and there are no bystanders, and also because the attacking forces do not have any ammunition. So, why don't we change the scenario where suddenly the coronavirus not only finds itself inactivated but also finds itself not in the respiratory system but in the skin near the respiratory system? Say, for example, in the skin at the back of the chest, or in the skin at other places of the chest, as well as in the skin below the chin. Well, now here the coronavirus cannot take refuge, anchorage, and reproduction and camouflage among the epithelial cells of the respiratory system because the battlefield has changed and it is now in the skin, and so here it cannot outwit and overwhelm the defense cells, especially the dendritic cells of the skin. And so the chances are that the dendritic cells, which are professional antigen presenting cells, will be able to activate a full spectrum of cells, including antibody producing cells as well as natural killer T cells, etc. And since now these antibodies, etc., will be in lymph and blood circulation in the nearby areas of the respiratory system, therefore, these antibodies will in no time also reach the respiratory system and start neutralizing the other coronaviruses which are infecting epithelial cells in the respiratory system. But the question is, how the hell will the coronavirus find itself inactivated, and how will it go to the skin of the back of the chest and the skin below the chin? Well, it will go there. It will not go there by itself naturally, but it will be the ICU doctor who will take coronavirus swab from the oral or nasal cavity or the pharynx of the corona sick patient, then will send it to the specially set up hospital lab where the pathologist or the microbiologist will inactivate the virus by either boiling or split inactivate the virus by using the detergent Triton X100. This detergent is commonly used in modern microbiology labs by the microbiologists to split inactivate viruses. This split inactivated or water boiled inactivated virus will then be sent back to the ICU doctor who will give this inactivated virus to the same patient by intradermal injection every 12 hours, that is BD, in the skin of the thorax and in the skin just below the chin. These BD intradermal inactivated virus inoculations from the same corona sick patient to himself in the intradermal skin of his own chest or in his own skin just below the chin. I call it the Sufi Hasib strategic inoculations, which is the yet another second possible treatment for coronavirus patients who have just started to have significant initial breathing discomfort, along with other supportive treatment. Note that the COVID-19 virus has to be inactivated before intradermal injection so that the COVID-19 virus cannot misuse the skin dendritic cells to hitchhike to other areas and skew the immunity. These Sufi Hasib strategic inoculations hopefully can produce sufficient defense cells and antibodies within the sick patient himself via the skin dendritic cells professional antigen presenting mechanism in a manner that the patient can fight the coronaviruses invading his lungs without causing much spillover inflammation in the lungs, and thus the patient can recover in a short period of time. In a short period of time, approximately 4 to 5 days. Kindly note that here too, no high tech setup is required. If you are an institution, you just have to have access to a private or hospital lab in an isolation area which can water boil inactivate or split inactivate the COVID 19 virus by using the Triton X100 detergent, and which can then isolate this inactivated virus in a manner safe for intradermal inoculations and then be able to send back the same safely and practically to the ICU doctor. Time is precious, and if we want that humanity gets a possible treatment for coronavirus COVID 19 in probably a short period of about 3 to 4 weeks, then we should all realize that we will have to give up the habit of rejecting every idea of a possible treatment as soon as it is presented, and we will have to open our minds and start thinking on the possibilities presented. Rising above all feelings of jealousy, bias, and all other prejudices in this corona epidemic, time is precious and I have my own limitations. So I have conveyed my idea of a second possibility of treatment of coronavirus COVID 19 by the proposed Sufi Hasib strategic inoculations method to the collective wisdom of you all. Now the ball is in your court. So now the ball is in your court. Please also note that I still have another one or two more ideas for a possible treatment of coronavirus COVID-19. Seeking good for you. Wassalam. Yours sincerely, Dr. Sufi Hasibul Hassan.